My favorite thing about Blinn's program is probably its clinical experience. I really feel that they do a wonderful job of giving the students the opportunity to put their skills in action, and you just never learn everything. There's every day you're learning something new.
Produced by Podcast Architects.
Hi, I'm Chelsea Reber. Welcome to Healthcare Calling. I'm visiting with Miranda Denman today. She is a clinical faculty instructor. If you want to learn more about Blinn's nursing program, check out the link in the description to head to the website. Miranda, thank you for joining me today.
Thank you for having me.
So I would love to learn a little bit more about you and how you got involved here at Blinn.
I have been a nurse for about 15 years, heading on 16 right now. When we moved to Texas and moved into this area, I started working at one of the local facilities and was approached by one of the clinical faculty to be a preceptor, and loved it. I got to precept multiple different students over the years, and as I went back, I'm an ADN graduate myself. When I went back to get my bachelor's and then my master's in nursing education, I stayed in close contact with the Blinn faculty and used them to get through my program, and really wanted to give back to the program because I felt that I received a lot in just being a preceptor.
Explain preceptor to me real quick before we move on.
Sure. A preceptor is a person on the unit that gets partnered with a student to help guide them, usually in that last couple of months before they graduate and start taking their NCLEX and become a nurse themselves. So it's really to help round them out and prepare them to step into the world of nursing.
When did you realize you wanted to be in the nursing profession?
I was a child, maybe
that
6.
Young, huh? Okay, wow.
Yeah, I am the baby of 9 with a whole bunch of nieces and nephews, and I just like taking care of people. One of my earliest memories as far as taking care of others and being a nurse, and that being my goal, was I made my own first aid kit.
Really? Okay, you have to tell me more about that. Was it in like a lunchbox or?
No, it was a repurposed jewelry box.
Oh, okay.
We took out the little ballerina. I painted a red cross on the top of it and painted the rest of it white, labeled it first aid, and had all sorts of goodies in there like gauze and peroxide, because we use peroxide for everything, and I had a honey bear jar that I had emptied out and filled with water so I could clean everything as my nieces and nephews.
That's awesome. And it's so funny because you said I'm the baby of 9, so I'm thinking, people were probably taking care of you your whole life, but with all the nieces and nephews coming on, that's really cool that you found your calling so early on. So Miranda, I want to talk a little bit more specifically about your role in the program and what kind of classes you teach.
So I am a member of the clinical faculty, which means I don't necessarily come into the classroom and teach them their didactic lessons, but I do get to work with them on the clinical sites in the hospital at the bedside. This semester in particular, I'm working with second semester, which I consider them the babies. This is their first real time getting an opportunity to take care of patients, work with our nursing staff, get comfortable in their own skin and realize they actually do know things. As we progress and go to the different semesters, they learn more and more about different disease processes, and we try to guide their clinical experience to kind of engulf that new information and give them an opportunity to really put it to use.
So what is a day in, like, let's say, okay, we're going to see Professor Denman, is that what they call you? Okay. And what might a typical day look like in your care, in your hands?
Sure. So before they get to me, they have to start with researching their patient. So they're going to see their patient the night before, or not see their patient, but pick their patient the night before. They'll pick it, they'll review so they have an understanding. So that's a lovely benefit that we don't get as nurses in real life, but it gets them started to really thinking about what they're looking for. When they come in the next morning at 6:30, they meet me, and we start our day with getting report, meeting our nurses, meeting our patients, working on our assessment skills. And then we start talking medication management. They go through a couple of quiz times with me, discussing what they already know about their medications and their patients and diagnoses. And then the rest of the time is really focused on getting that opportunity to care for patients, and observe the nurses and really see what goes on in a day in the life of a nurse.
How much goes into teaching students how to interact with their patients and how to, you hear from patients that their nurse is who truly made the difference during their time under care. Obviously, the doctors do a lot, but the nurse seems to really be the primary person who's around them the most. So how much goes into teaching students how to be a people person, how to be a patient person?
So that is a part of the education that is wrapped in every single interaction that they have. And I enjoy watching them, especially in the second semester, as they go from scared to enter a room on their own. They'll grab a partner and walk in there together, just to bolster them. And then a lot of it is confidence. It's not so much that they aren't people, but they are not confident in their own abilities. So it's building that confidence and letting them know you don't have to have all the answers. Yet again, it's okay, but really help that patient to understand, I'm here to help you. If I don't have an answer, I'm going to help you find the answer, and that's okay too. The end of the semester, it's really neat to watch their transition, and then when they do their what's it called? Sorry. When we have our debriefing at the end of the day, that's kind of their opportunity to tell me what is happening for their patient, what is going on, what did they learn from the day, and that changes through the course of the semester. The end of the semester, they're voicing that they're going to miss their patients, or their patients are asking, do you really have to leave?
Aww.
And so they really get to feel that connection, and that's truly only going to be established through the clinical experience.
I know you mentioned that you've wanted to be a nurse since you were a child, but did you have any personal experiences with nurses growing up, or maybe even in your education, that have stuck with you even to today?
So, yes, we've all had some sort of experience. For me, it would be when I was about 18. My mom actually had small cell lung cancer, and she passed away. Again, I already said that I'm a baby of 9.
Yeah.
So in that process, she kind of went on hospice care, and we were staying in the hospital. And the nurses, while I don't have individual people, it was very tumultuous, but
Sure.
I don't have individual names, but just the gentleness that they approached everyone with, the care and the compassion that they showed. All 9 of us ended up sleeping in their conference room. They brought us all the things that we needed to make cots, and we set up all in there and took turns being with my mom until she passed. And that was not something that they had to do, but they absolutely really made a difference for our family.
Is there anyone else in your family that's in healthcare?
Ooh. Mostly no. There's actually very few in healthcare. I have a cousin who is also a nurse, but pretty much everybody else says they don't want to handle that job. It's too much.
So do you get calls and texts all the time? Miranda, what's wrong with me?
I do. Family,
Telehealth,
friends.
family telehealth.
Yeah. I'll get, my favorites are the ones that I haven't talked to in a long time, and then I'll randomly get a message. I'm like, okay. But it's okay.
Yeah.
I enjoy it.
Do you have any patients that have reached out, contacted you, maybe even after the fact, months down the line, just to say thank you? What does that mean to you?
That is what makes every day worth going in. So I'm an instructor, but I'm also an oncology nurse. So I've been an oncology nurse for over 15 years. we treat people at some very low points in life and take care of them and try to see them through it. My favorite times at the bedside, my favorite times are when we get a visit and I don't recognize the person that's standing in front of me because they're healthy and they've put on weight and they look so happy and they're doing so well. And those are the moments that get you through every low point.
I know you mentioned your mom. Did that draw you to oncology?
No.
Okay.
That actually made me, I was 18 again when she passed, and I was petrified of oncology. And my first job that I received was a medical surgical oncology department. And I told them in the interview that I was scared to death, that I was going to get a patient that reminded me of my mom, and I just didn't know how I was going to handle it. And they said they would support me. They would start me separately on the med-surg patients, which they did. And then everybody got pregnant on the unit, and I became the oncology nurse and had to learn chemotherapy. But and I had the patient that reminded me of my mom. And it was difficult, but I got closure that I did not expect to be able to receive. And I got to work with oncology patients who are probably the best people in the world. They're so appreciative and thankful, regardless of what they're going through. So they made me passionate about it.
Do you want to learn the 5 steps you must take now to prevent attrition in your nursing staff? Click the link in the description and fill out the form to receive our informational sheet. Miranda, what does the work that you do in nursing mean to you? And are there any other ways that you give back?
Wow, that's a loaded question. So my work in nursing gives me the opportunity to give back to my community, to really care for others. That is one of the greatest benefits in nursing. I can do pretty much anything. There's so many different varied ways I can go about it and still get to give back. I'm big into community involvement, so one of the other things that I do is Habitat for Humanity, and that is another just great way for me to feel part of the community and work alongside my neighbors. I also go, not just my neighbors, so I go to Guatemala and do global village trips and get to do the same thing.
Now, do you do any kind of nursing when you're on those trips, or is that strictly Habitat for Humanity type stuff?
It is Habitat for Humanity stuff. I get to build. I try to take a little bit of a break from nursing,
Sure.
But I end up becoming the group nurse and making sure that everyone is doing okay, and especially with altitude sickness and things like that. So that's usually my role, but I'm not the advertised nurse on duty.
Yeah,
so.
That's great that you get to give back in other ways besides just with nursing. What do you feel is unique about Blinn's associate program that provides value for the students who come through the program?
So my favorite thing about Blinn's program is probably its clinical experience. I really feel that they do a wonderful job of giving the students the opportunity to put their skills in action, work with their future colleagues, and really learn on the job how to manage so many different experiences that can pop up in their day.
It seems like in nursing, you can't learn everything in the classroom.
You can never learn everything in the classroom, and you just never learn everything. There's every day you're learning something new.
So Blinn is able to put their students in these situations before life and death truly is on the table.
Yes, and that is one of the major goals. We have an excellent SIM program to really give students a safe opportunity to make mistakes and learn from those mistakes.
How does Blinn help connect students with industry for job placement after graduation?
So Blinn has been in this community for a very long time, so they have really good community ties with our facilities that are here local, St. Joseph's and Scott and White to be the biggest ones that pop out. We do career fairs, and they are communicated with through their faculty and boards what is coming up in the future. They also have a Blinn Nursing Student Association, and they actually set up a meeting with some of the local leaders to talk about what do you look for in a new candidate? What what would be your, pieces of advice before we come and interview with you? What do you want to see in an interview? So we get that opportunity to really connect with them and help guide them before they step in. And it's nerve-wracking to sit in front of a panel of people and your fate is in their hands.
Sure. You mentioned earlier with nursing, you can do so many things. Do students often come in with one idea of what they want to do and leave with a totally different idea?
Absolutely. And that's part of our role, is to help them learn about the different options that are out there and experience them and really give them a true opportunity to experience it. We listen to what they say they want to do, but we still push them to really try something outside of what they think their comfort zone is. And it's always fun to watch them go and have a day in an area that they were dreading before going to, and then come back and just be all smiles and super excited. And then they turn it around on you like, now I have to decide what I want to do.
Yeah. Did you ever expect to be on the educational side of things?
That was not my plan. I love teaching, and that was the secondary passion, but I never really thought about teaching future nurses. It was always nursing, or it never occurred to me for the longest time that I could do both, until I started actually precepting and had that interaction and interacted with the faculty as well. I'm like, I could do that. I could totally do that.
Do you see that in some of your students already, that they may be a future teacher as well?
Yes, and I already start tagging them and letting them know that I'm not going to forget.
What experiences at Blinn make it worth being there every year with the students?
It's probably watching the growth, and it's the aha moments. So I am a question asker. I can't see inside of their brains. I ask why a lot, and I like to see their thought process as they go through their explanations to me. And to carry that from the very beginning, when I get to see them, to even just the end of the semester, and their thought process changes. But really, it's when they start answering my questions and they're super nervous, and then they make a connection. It's like, the light bulb just went off. We're good. I got it.
That's awesome. What advice would you give to a recent graduate of the program at Blinn as they're going into their career?
Be open. Be humble. Ask questions. You will not come out of a program knowing everything that you need to know as a new nurse. And that's okay. None of us do. So just ask those questions. Get involved in wherever you're at, to, be part of shared governance and just learn a little bit more about what is your institution doing? How are they impacting your community? What can you do to help improve that? And you get to be fresh eyes. We don't get that. I've been around for a long time. I see things a certain way, so it's really nice to get them involved.
You mentioned you went through a similar program, correct?
Mm-hmm.
Why do you think programs like Blinn's is unique and really sets itself apart from other similar ones across the country?
My favorite thing about an ADN program that is done well is the clinical time. Blinn puts a lot of focus on making sure that not just patients, that the students get that opportunity to work with patients, get comfortable in their role, and put to the test what they're learning in the classroom. Some of the larger institutions really focus on giving a lot of information, which is great. We need a lot of information, but they just don't always get that same hands-on experience for the students. And I think Blinn does an excellent job with giving them that.
Why should future nurses apply to come to Blinn?
They get to work with me.
That's a great reason.
No, I think it's just a group of people, a group of nurses that are really focused on helping our students become nurses, become our peers, and eventually become our caregivers.
What do you hope for the future of Blinn Nursing?
Oh, I want to see growth. I want to see more and more of our community supported by our community. So I would love to see more of our Blinn students come and stick around and really show their investment with our community. It's a great group to be part of. So,
Miranda, thank you so much for joining us today on Healthcare Calling. I really appreciate it.
thank you so much. I appreciate it.
If you are interested in learning more about Blinn's nursing program, check out the link in the description to head to the website.
Produced by Podcast Architects.